morning, good afternoon, everyone in your different time zones. This is MedSafe Hospital, medical department, and today's health talk is going to be about peptic ulcer disease, what most of you call ulcers. So we shall talk about what brings out the peptic ulcer disease, risk factors, types, how it comes about, how we test and confirm, complications, and how we manage, and lastly, what people need to know about peptic ulcer disease. So what we call peptic ulcer disease, in a medical term, peptic ulcer is a lesion in the mucosa, which is the lining of the digestive tract. Here basically tutegeeza nti kyetwandiise an ulcer munda mu lubuto tulinamu layer protecting olubuto munda. Eyo layer bwefunako eni lyewandiyisebbwa ekyefe kyetwandiise peptic ulcer disease, and it's commonly caused by the digestive action of the pepsin and the stomach acids. So here basically it is the acids in our stomach that usually cause this, and these ulcers can always be in the stomach or in the duodenum. Duodenum is always the first part of your small intestines. How common it is about 1 in 10 people have this problem. So how we know that you have ulcers? Usually people complain of pain. Actually most people it is pain. Some people the pain is after eating or before meals. Some people the pain is worse when you eat food. That is common for gastric ulcers. And some other people complain of nausea, vomiting. All the time you have your stomach is full, you have that abdominal discomfort. And other people they have this. The pain is usually in different areas depending on different people. But also people think that when you have blood in stool it is ulcers, but that is not peptic ulcer disease, and I would say it is always a different disease. So when you have blood in stool, that is never peptic ulcer disease. So when you come to the hospital, you usually ask the risk factors. Risk factors are things which usually predispose, which would make you more susceptible, which would put you at a risk of getting this peptic ulcer disease. And these things include H. pylori infection. H. pylori is a bacteria, Helicobacter pylorus, and this is a very common. Another thing about our lifestyles, smoking, drinking alcohol, and also taking acidic drinks. And also commonly is about you people taking NSAID. NSAID, we mean these are tablets like ibuprofen, what you usually take for pain. So for you, every time you get pain, you decide to take ibuprofen instead of paracetamol. So like as had earlier said, these ulcers are in 2 types. We have duodenal, which is the first part of your small intestine, and also the gastric. The one is in the stomach and another one is in the duodenum. So talking about what causes it, it's mostly because of the imbalance between something that protects your stomach and something that destroy your stomach wall. So in this point we are meaning, as you can see, this side of aggressive factors, that's why we talked about Helicobacter pylorus, taking alcohol, taking NSAIDs. I've talked about this. You take ibuprofen, you have cramps, you take piroxicam, and also bile reflux. Here on our left, these are the things which can worsen, which can destroy our stomach wall. Then here on the right are things which protect your stomach wall. These are normally there in your body. And what you should know about this bacteria, it is fecal-oral or it is oral, meaning that when you get in contact with stool that has that bacteria and you ingest it, that's how you get to have that problem of peptic. That's how that bacteria gets into your system. Now when you come to us, when you come to the hospital, we try as much as we can to confirm that if you have peptic ulcer, it is peptic ulcer disease. And usually what people should know, that not every abdominal pain is peptic ulcer disease, or it is ulcers, as you always say. So once you come in the hospital, we usually tell you shall check your blood and your stool. So when you are checking your blood, we want to see the amount of blood remaining. What you need to know, that these ulcers can go as they can eat up to the whole stomach wall, and then you start bleeding. So the level of bleeding can be seen from here, from doing a CBC, and also we do things like iron levels. Then for confirmatory tests, we do what we call H. pylori stool antigen, and this is the confirmatory test we do. Once it is negative, you don't have peptic ulcer disease, but you can have any other thing or any other diseases that can cause you to have severe abdominal pain. And then we do fecal cut blood test. This is done when you have, like, when you're passing out dark colored stool. Usually that's a sign of you're bleeding from up in the GIT system. Then if you have the recurrent ulcers, you're not healing, we do something we call endoscopy. This is where we get a camera and it directly looks into your stomach, and we look at the stomach wall. This is a camera that goes deep inside into your stomach and looks at the ulcer. The good thing with this kind of investigation, that it is diagnostic, that is, it sees the real problem, and also sometimes it is always relevant. We pick a biopsy. So that's how we investigate for someone who has peptic ulcer disease. Then when you start on management, when we are treating, we have aims as why we are treating. The goals, we have to alleviate, to treat the symptoms. Then we have to reduce this acid. Like earlier told you, this disease is mainly because of excess acid secretion in your stomach. And then the final part is we are eradicating this bacteria, and we call it total eradication therapy. So those are our goals when you're managing peptic ulcer disease. Then we have some challenges when you're managing this. One thing is the pill burden, that you'll be taking a minimum of 3 tablets in a day. That is in the morning and also in the evening. So it's a pill. We still have a challenge of pill burden, that you'll be taking many tablets, and that is the standard treatment as of now. And also the course of duration is always long, which is a minimum of 3 weeks. And then the challenge we have with this, that people take it for only a maximum of 1 week, and usually patients stop once the symptoms reduce. Once the abdominal pain has gone, they think they have healed, which is actually very wrong. And most of you do not come back for follow-up. Once you do the test and you receive treatment, you're supposed to come back. We confirm that you have actually healed. And then lastly, we have nowadays what we call drug resistance. This is when the antibiotics are no longer working as they should work. Then how we manage, we usually we reduce as much as you can things that expose you to that destroy the stomach lining. Stop or reduce the inside exposure, stop the smoking, stop the alcohol. And then, like I told you, we use a couple of many drugs. Some of them are hyposecretory. These are drugs that reduce on the acid. Then the drugs that help in eradicating the bacteria, and also the drugs that help to protect the surface of our stomach wall. Then what we need to know as a public, that this peptic ulcer disease has complications. This ulcer, as I told you, is in it can go through your stomach wall. Some people come when they are anemic. Anemic is when your blood volume has reduced. You actually come with symptoms, kamunguluze, things that show that your blood has reduced. Some people have coughing, they start have this brown vomitus, and also some actually come when the whole stomach wall has perforated and they have features of severe abdominal pain. And then what you will need also to know, you can have issues with gastric outlet obstruction. Emmere ebatefuluma bulungi kuva mu lubuto kugenda mu kyenda ekisooka. Then lastly, what worries us most is the more you are exposed to peptic ulcer disease, you're more exposed to getting gastric carcinoma, which is a cancer of the stomach. Lastly, not everyone who has abdominal pain has ulcers, and we always encourage you get checked and you avoid self-medication, avoid NSAIDs, and also use Panadol where you can. Then in an event that you can't avoid NSAIDs, use them with antihistamine or an antacid like omeprazole. Then one last thing you should know, that avoid testing blood to check for peptic ulcer disease, because it will always be positive. And also get checked and avoid self-medication. Once again, this is MedSafe Hospital Medical Department, caring for your health.